New Democrats are putting healthcare front and center during this election. Not because it's fundamentally broken. In many ways, Medicare is working well enough to inspire the top achievement of the Obama presidency. But it was the vision of our country's greatest Canadian, Tommy Douglas. Equal access to physician and hospital care, no matter where you lived or how much money you make. Without leadership, we risk falling back to a more primitive era, when people were on their own, when folks sold their farms or suffered because they couldn't afford care. Because Medicare is under constant threat from those who see sickness as an opportunity for profit. And as privatization creeps forward, it poisons public health care by sapping its resources. Ottawa needs to stop privatization and to start enforcing the Canada Health Act. But we can't win a purely defensive battle. We need positive leadership to modernize the system, because there's a growing mismatch between what Medicare covers and what people need. And if we don't fill that gap now, the privateers will rush in and claim it. New Democrats are ready to modernize Medicare for the 21st century, with ideas straight from the Romanow Report, because they're as fresh today as they were 8 years ago. One burning priority is to adapt to Canada's aging population. By 2026, the number of Canadian seniors will double to 8 million. These are folks who worked hard, paid their dues, and deserve dignity in their elder years. So we need to start building capacity in home care and long-term care now. We're already falling behind. Some hospitals now devote a quarter of their acute beds to seniors waiting for better options. Expanding quality, affordable long-term and home care will ease the pressures on hospitals, cut wait lists, and give seniors their dignity. Roy Romanow called home care the next essential service, and we're ready to make home care the first major expansion of public Medicare in 40 years. Our next priority is to tackle runaway prescription drug costs. Drugs are increasingly central to treatment. We spend more on drugs than on doctors, and drugs are the fastest growing part of our health spending, far outpacing inflation. Nearly 4 million Canadians have no drug insurance at all, and they're spending $4 billion out of their pocket for drugs that their doctors prescribe. Many are choosing between financial hardship and needless suffering. It's time for a national prescription drug strategy. It starts with catastrophic drug coverage for every Canadian, not a hit and miss patchwork of coverage across provinces. That strategy should include national bulk buying to ease costs. Australia's drug spending growth is half what it is for our provinces, thanks to bulk buying. Since 2004, the provinces have been calling on Ottawa to show leadership on farm care, and there's no excuse not to deliver. Third, Canada urgently needs a health human resource strategy. Prevention starts with early intervention, but 5 million Canadians don't have a family doctor. For them, at best, primary care means an emergency ward. Communities like Kingsville and Lakeshore could also benefit greatly from community health clinics to serve their needs and to facilitate treatment. We've put forward practical ideas to work with provinces to train more doctors and to recognize the credentials of more foreign-trained doctors. Finally, let's implement what Tommy called Phase 2 of Medicare, prevention through healthy living. I know what it's like to rush a child to a hospital when the air is thick with smog, and air pollution is killing 20,000 of us each year. So let's ramp up our efforts to change that. Rampant childhood obesity is a wake-up call. Inactivity is now literally killing us. What Canada needs is a national strategy that recognizes all the social determinants of health. That includes poverty, decent housing, the environment, education, and freedom from violence. You know that's something that'll be led by New Democrats and no one else.